All right. Chapter 14. So a lot of this chapter will actually cover definitions. Okay, so make sure you understand what all these terms mean. Okay. Okay. So define pathology, ethology, definition, infection, and disease. Okay, so these guys are all definitions, right? So I want to make sure you guys understand what the definitions of all these things are. Okay. Okay. So next thing, the human biome, okay, or microbiome. Okay. Um, the human biome begins to be established in utero. Okay, and then after you're born, microorganisms are required from food, people, pets, actually even being born, coming out of the vagina. You actually pick up microorganisms on the way out. So maybe to have that come out via C-section will be slightly different than maybe that come out um, through the vagina. It's actually one of the cooler studies. Okay. Okay. The human microbiome project is currently going on. The normal biota is the normal one, and transient is transient, so it can change. But we don't know exactly what is normal and what is transient yet. Okay, because that's kind of hard to measure. Okay, representative microbiota for different regions of the body. You can see nasal epithelium. There's some lining of the stomach. There's some in the small intestine. There's some. We used to think that there wasn't very much in the stomach and small intestine. But we were wrong. There are actually bacteria down there. Okay, there's even bacteria like I'm sure you guys probably heard that urine was sterile and stuff. It's really not. Okay, and we're learning we can find bacteria basically everywhere. Okay. Oops. All right. Hopefully, I didn't. I didn't realize I wasn't sharing my screen. Okay. So the distribution and composition of the normal microbiota are determined by many factors. Okay, nutrients, physical and chemical factors, health defenses, mechanical factors. Okay, so you can see where they all are. Okay. Okay. Oops. Okay. So I just mentioned this, right? Okay. Okay. Next important concept is microbial antagonism, or the idea of competitive exclusion. Okay. Normal microbiota protects the host by competing for nutrients, producing substances that are harmful to invading microbes, affecting pH and available oxygen levels. Also, squatting rates basically is what it boils down to. Okay. Normal microbiota are there first, and if they're first for a pathogenic bacteria to take over, they have to first get the normal microbiota out of the way. And sometimes that's really hard because the normal microbiota are already there. So you can't establish a foothold. Okay. Okay. So relationship between the normal microbiota and the host. Okay. So the theory of symbiosis. Okay. Symbiosis. Same. Bios, life. Okay. So shared life. Okay, is the relationship between normal microbiota and host. Okay. The concept symbiosis comes in three forms: mutualism, commensalism, parasitism. Okay, mutualism is both organisms benefit. Okay, example of that: the E. coli in our large intestines. Okay, the E. coli in our large intestines, they benefit because we feed them and we provide them with a warm, wet place to live. They provide us with a little bit of vitamins and a little bit of defense. Okay. Okay. Commensalism, one organism benefits, the other is unaffected. Like the bacteria that live on the surface of our skin, we don't really give a shit about them. Like, it doesn't matter if they're there or not. Okay, they don't benefit us in any way, but they also don't harm us in any meaningful way. So they get a nice place to live, and they eat some dead stuff off our skin, um, but not in any meaningful amount. So one organism benefits, the other is unaffected. Parasitism, okay, is one organism benefits at the expense of the other. Okay, they're parasites, right? So if you think about normal microbiota, they're not normally parasitic, but they can be. Okay, if Staph aureus gets into your bloodstream, it can turn into a parasite and feed off nutrients there, while causing you disease and a bunch of other things. Okay, like Candida albicans can overgrow in the vagina and cause yeast infections. Okay, so one organism benefits at the expense of the other. Okay, where normal microbiota turns into parasites, they're usually known as opportunistic pathogens. Okay, they take advantage of the situation. One of the most likely things is one of two cases. One, you're on high level antibiotics, and that wipes out the other biota that's there, and that allows the normal microbiota to go wild and go crazy, like yeast infections. The other is if you immunosuppress. Okay. Okay. So I'm gonna make a little joke about COVID. Okay, a bunch of people are saying, 200,000 people didn't die of COVID-19 in the U.S. because all these people have comorbidities and they died of other stuff with COVID. Okay, that's complete bullshit. And I was like, why? No one ever dies of AIDS, ever. If you want to go by this rule, because you don't die of AIDS. AIDS renders your immune system useless, and you die of like opportunistic infections that no one else with a even barely functioning immune system would get. You would get, and you would die of one. Okay, so technically you don't die of AIDS, you die of complications due to AIDS. So like that's how stupid it sounds. That's literally using word for word how stupid it sounds. So don't believe that shit. Okay, opportunistic pathogens can kill you when your immune system is weakened. Okay, so COVID-19 does the same thing. COVID-19, amongst the other things it causes, is pneumonia, which can kill you, but obviously it's because your lungs are weakened by COVID-19. Okay, the number one comorbidity of COVID-19 is pneumonia. Okay, or at least the last time I checked. All right. Okay. Okay. The theology of infectious diseases. This is cautious postulates. Okay. The same pathogen must be present in every case of the disease. The pathogen. So let's go over what it looks like. Okay. So dead mouse. You want to know what caused the mouse to die. You think it's a bacterial infection. You take out the bacteria. You have to then grow it in a pure culture, so you know exactly what bacteria you're looking at. Okay, you take the microorganism and you inject it in a healthy mouse. The healthy mouse will then die from the infection, and usually it has to die the same way as the diseased animal. You have to re-extract the bacteria from that newly dead mouse, and they must match the original bacteria that you got. Okay, all those things must be true to demonstrate a specific illness or a specific bacteria causes a specific disease. Okay, all right. So you can do that to mice because no one really gives a shit too much about mice, but you can't really do that to humans, right? So here are the exceptions to cautious postulates. Some pathogens can cause different disease conditions and different amounts. Staph causes a bunch of different diseases. Some diseases only cause, some pathogens only cause disease in humans, okay? Like smallpox is only in humans. Polio is only in humans, okay? HIV is only in humans. And therefore you can't really say, look, I'm gonna, inject people with HIV and see if they die, okay? Um, so another interesting story, for people who think masks don't help against COVID-19, there was this really cool study that showed masks do help, except they did it in guinea pigs. They used guinea pigs are susceptible to COVID or coronaviruses anyway, and so they put little masks on their cages and spray them and see how many of them survive, etc., etc. They did a really cool study that showed like unequivocally to anybody who actually read the story that masks help. So I was arguing with this guy on the internet, which usually I've been a waste of my time, but I was bored. And he was like, that study doesn't mean anything. It's not in guinea pigs. And I was like, what you want people to do? Like spray each other with COVID-19 and see if they die? Like that would be like the only way you can really prove that the mask work on humans. And then he just kind of shut up because he realized that's exactly what he was asking for and how humane that would actually be. So yeah, Koch postulates sometimes can't be applied to humans. Okay. And then the last one, some microbes can't be cultured, some viruses and stuff can't really be cultured. Okay. All right. Differentiate communicable disease from a non-communicable disease. Okay. So categorize diseases according to frequency of occurrence. Categorize diseases according to severity. Define the concept of herd immunity. So let's talk about all these things. Okay, you should definitely be able to do all four of these things. Okay, first of all, what a sign and symptom are. Okay, a sign is a change in the body that can be measured. So a physical, measurement. Like, hey, you have a fever of 104. That is a sign. I feel like shit is a symptom. Okay. So like, I feel sweaty or I feel like puking is a symptom. I'm actually puking is a sign. Okay. So make sure you know the difference. A syndrome is a specific sign of a specific group of signs and symptoms that accompany a disease. Okay. Okay. Communicable disease is a disease that can be spread from one host to another. So COVID-19. A contagious disease is a disease that's very easily spread and from one host to another. Okay. Non-communicable disease is a disease that cannot spread from one host to another. So cancer, for example, not non-communicable disease. Okay.
Epidemiology is the study of where and when diseases occur and how they're transmitted. The knowledge obtained from epidemiology is of critical importance in learning how to treat and prevent various diseases.
Okay. Okay. More definitions. Incidence is the number of people who develop a disease during a particular time period. Prevalence is the number of people who develop a disease at a specific time, regardless of when it first appeared. Okay, so incidence is a much shorter time period than prevalence. Okay, so prevalence will always be a bigger number than incidence. Okay, incidence will be the number of people who develop the disease, say in this month. Prevalence will be people who have developed the disease at a specific time in this month who have had COVID-19 so far. Okay. Okay. So here, okay.
The prevalence of a disease is the number of cases, including both new cases and previously existing cases. The expected prevalence of a disease is the prevalence that's expected based on patterns established by past observations. The incidence of a disease is the number of new cases over some period of time. Let's see how epidemiologists use prevalence and incidence data to evaluate the status of a particular disease. A disease is sporadic in a region if only a few cases occur in that region. A disease is endemic in a region if it normally and continually occurs there at a fairly stable rate. A disease is epidemic in a region if it occurs there at a rate significantly higher than would be normally expected. A disease is pandemic if it's an epidemic on more than one continent at the same time. Now watch the incidence and prevalence data and see if you can recognize when an epidemic or pandemic occurs.
Okay. Hopefully you guys were able to catch a couple of pandemics that showed up there. Okay. And again, they already explain what these four are, so make sure you understand those four. Okay. Okay. So here is the number of cases reported HIV/AIDS cases in the United States. This is an expansion of surveillance case definition. Okay, it is not actually more cases. It is like you change the definition of what HIV and AIDS are, or you increase testing dramatically. Okay. Okay. So the severity of or duration of the disease. Acute disease develops rapidly, so it's acute, but lasts over a short amount of time. Okay. Chronic disease, the symptoms develop slowly. Okay. Subacute is between acute and chronic. latent disease is the causative agent is inactive for a period, then reactivates and produces symptoms. The symptoms to be different the second time around than the first time. It's called latent disease. Like cold sores go away and come back, go away and come back. It's always the same disease. Chickenpox goes away and comes back as shingles. Okay, it's still a latent disease. Okay, herd immunity is an immunity in most of the population. Otherwise known as herd mentality by Donald Trump. Okay, let's then the host involvement. Local infection is where the like only a certain body part, like your arm, is infected and stuff like that. Okay. Okay. A systemic infection is throughout the body. A focal infection starts as a systemic infection that has a focal point. Focal point is the site of the local infection. Okay. All right. Sepsis is an inflammatory condition arising from the spread of microbes, especially bacteria and their toxins, from focused infection. So you get widespread inflammatory condition. Okay, that's sepsis. Okay. Sepsis can actually kill you. So much fluid can leave your bloodstream and you can, suffer from heart failure and stuff. Okay. Bacteremia is just bacteria in the blood. Septicemia is different. Septicemia is bacteria in the blood, but they're growing. They're actually actively dividing in the bloodstream. Okay. So very big difference there. Okay. Toxemia is the toxins, viremia is viruses. Okay. So primary infection is an acute infection that causes the initial illness. Okay. Secondary infection is an opportunistic infection after a primary infection. Like, for example, if you have bad cold, you're at a risk to develop pneumonia. Pneumonia will be the secondary infection after a primary infection, which is cold. Okay. Okay. So Clostridium perfringens causes communicable disease. The answer is no. It causes food poisoning. Food poisoning is not communicable. Okay. Distinguish incidence from prevalence of the disease. We were talking about that. Okay. Incidence is the number of new infection. Prevalence is total. Okay. Okay. Okay, so here are the predisposing factors to disease. Okay. All right. The development of disease. So the incubation period, the interval between initial infection to first signs and symptoms. Okay. That is they tell you the incubation period for COVID-19 is 2 to 14 days. Right. The prodromal period is a short time after incubation where you get mild symptoms. Okay. The period of illness is where the illness is most severe, and then decline, and then convalescence. Okay. So. Okay. The spread of infection, so reservoirs. Okay. Okay, so reservoirs of infection are continuous sources of infection, like people who have it, animals who have it, non-living reservoirs that have it. Okay. human reservoirs. Okay. Um, human reservoirs are people who have the disease, and some of them might be carriers for infection and not know they have it or have latent diseases. So they have cold sores and it's not showing on them because they're not having an outbreak. Doesn't mean they don't have it, doesn't mean they can't transmit it to you, although the risk of that is very, very small. But I'll give you guys a really cool case. If you Google typhoid Mary, or you've probably heard of that term before, okay? She was a carrier for typhus. She had no symptoms. So a lot of people are carriers of typhus in their gallbladder and liver, and they don't show it. They have no symptoms of it, but they can spread it. And this woman worked as a cook in like big huge kitchens and stuff. And every time she spread it, and people got sick, and then they put her, you know, they figured out what it was. They fired her. Um, they told her she was a carrier. She refused to believe it because this was 100 years ago, and she was like, "I don't have the disease, so what the hell are you telling me this for? Like, I need to work as a cook, or else I would starve." And so it went on until at some point they literally just had to lock her up in an institution for her own good, for the health benefit of everybody else. Okay. Animal reservoirs are so zoonoses are diseases that are spread from animals to humans. I'm sure you guys all know COVID-19 is from rats. Okay. Non-living reservoirs like soil and water, tetanus and botulism, they can live in soil. Okay. All right, so contact transmission, direct contact, touching, okay. Congenital transmission from mother to fetus. Indirect contact, so I touch something, you touch something, you get it from me. Like if we share utensils or we share like drinking water, stuff like that. Okay. The non-living object is called a fomite. Okay. Um, it looks like COVID-19 doesn't spread through fomites, or not in any meaningful level. I think there's only one documented case of COVID-19 spreading through fomites. Okay, droplet transmission. This definitely is the transmission route for COVID-19. Transmission via airborne droplets less than 1 meter. Okay. Okay. Vehicle transmission. Okay, is transmission by inanimate reservoir. It can be either airborne, waterborne, or foodborne. There's some data to suggest that airborne transmission of COVID-19 does work. So airborne can spread through the air. Technically, through the air, it can spread for miles. Water obviously can spread from really far, and then food. Okay, make sure you understand all that because that's going to be on the quiz. Okay. Okay. Vectors, arthropods, especially fleas, ticks, and mosquitoes, transmit diseases by two general methods, either mechanical transmission or biological transmission. The difference between the two is replication. Okay. The biological transmission, the vector, the disease has to, pathogen has to reproduce in the vector, and that's usually transmitted via the bites or the feces of the animal. Okay. Mechanical transmission, fly lands on pile poop, and then lands on your food and you eat food. Okay. Not there's as long as there's no reproduction. Okay. fly can eat the bacteria, puke on your bacteria, or puke on your food. That would also be mechanical transmission. And yes, flies puke up their food every time they want to eat new food. So, okay, mechanical transmission. Okay.
Infectious diseases are transmitted from either a host's portal of exit or a reservoir to a new host. There are three major categories of transmission: contact transmission, vehicle transmission, and vector transmission. Contact transmission is the spread of pathogens by direct contact, indirect contact, or droplets. Direct contact can include touching, kissing, or sexual intercourse. It can also include transfer from mother to fetus and contact within a single individual, such as between the nose and the eye. Droplet transmission occurs via mucus droplets within a distance of less than 1 meter. This can occur while exhaling, speaking, coughing, or sneezing. Indirect contact involves spreading of pathogens by inanimate objects called fomites. Fomites can include needles, eating utensils, money, tissues, toys, and medical equipment. The second major category of transmission is by vehicle. Vehicles can be air, water, and food, as well as bodily fluids such as blood that are handled outside of the body. Airborne transmission involves the spread of pathogens via an aerosol. This aerosol can be either dust or droplets traveling farther than 1 meter. Waterborne transmission is a major mode of transmission for many gastrointestinal diseases such as cholera. This usually occurs when fecal material enters the water supply. Foodborne transmission is also typical of many gastrointestinal diseases. The pathogens may enter the body in food that is improperly prepared or contaminated with fecal material. Vectors are arthropods that transmit diseases from one host to another. The term vector is most often used to describe insects or arachnids that are part of the pathogen's life cycle. For instance, the mosquito in malaria or the flea in bubonic plague. However, some insects can also passively carry pathogens with their bodies. For instance, a fly may carry typhoid or dysentery from a host's feces to the food of another person.
Okay. Okay, blah, blah, blah. I should be able to answer all these questions. Okay. Nosocomial infections or healthcare associated infections are acquired while receiving treatment in a care facility. These are actually really high, really because if you're in a hospital, you're sick with something, so you already have you're already sick. And two, there's a lot of sick people around you, all of which are sick with different things. So, and add to that the transmission of antibiotic resistance things and all that add up together very quickly. Okay.
Nosocomial infections are those infections acquired by patients while they're in a healthcare setting. It's estimated that 30% of nosocomial infections are preventable through more stringent use of a septic technique by healthcare personnel. There are 5 major categories of nosocomial infections. The most common type of nosocomial infection is a urinary tract infection. These are typically contracted during insertion or removal of urinary catheters and usually involve the normal flora of the patient or healthcare worker. The second most common type of nosocomial infection is a surgical wound infection, again caused by normal skin flora that get into the surgical wound. Lower respiratory infections are usually associated with respiratory devices. Cutaneous infections commonly occur in newborns and burn patients. Bacteremias are another type of nosocomial infection, usually due to intravenous catheterizations or injections. All other infection types account for about 11% of all nosocomial infections. Patients are susceptible to nosocomial infections because their immune systems are already weakened. The stress of surgery on the body also makes it harder to mount an adequate defense against these microbes. The exposure of the compromised patient to antibiotics, whether as treatments or as aerosols in the environment, allows resistant microbes to become abundant and cause disease. Healthcare personnel are often carriers of resistant microbes. The need for invasive procedures such as injections, insertion of catheters, or surgery increases the chance that microbes from the skin can enter the bloodstream. And finally, the constant movement of staff and visitors among the patients increases the chance that microorganisms can be passed from one person to another.
All right. So there you go. Okay. Okay. So I'm sure you know all this already, right? So
Nosocomial infections cause thousands of deaths and cost the healthcare industry millions of dollars each year. This can be avoided if healthcare personnel and patients know and practice the proper precautions. One study showed that hospital personnel only wash their hands 40% of the time before interacting with patients. The first goal of a healthcare professional should always be the health of the patient. Proper and frequent hand washing by personnel is the most important method of preventing transmission of nosocomial infections. Healthcare workers should wash their hands thoroughly before and after interacting with patients. Proper disinfection and sterilization of equipment also helps to minimize nosocomial infections. Healthcare workers should wear personal protective equipment when appropriate. Catheters, intubation devices, and needles should be sterile, preferably single-use disposable devices, and should be inserted using aseptic technique. Contaminated material should be disposed of promptly and properly. Healthcare personnel should not come to work sick. Most importantly, all healthcare employees should receive periodic training in the proper precautions for infection control. Physicians should prescribe antibiotics only when necessary, and antibiotics should be rotated within a hospital setting so that resistance is minimized. Invasive procedures should be performed only when necessary and using aseptic technique. Immunosuppressive drugs should be used only when necessary, and extra precautions should be taken to minimize exposure of the patient to microorganisms. Patients can prevent nosocomial infections by following the directions of their healthcare professionals. If a patient notices a healthcare worker not following the suggested precautions, they should bring it to their attention. Proper cleaning and hand washing is important for patients also.
okay. Blah, blah. Okay. Okay, so obviously we're teaching microbiology in the middle of a pandemic, which is always interesting. Okay, emerging infectious diseases. Okay, contributing factors, genetic recombination, E. coli, H1N1, evolution of new strains. So, a couple of things. The E. coli 0157 is basically because we are giving cows a lot of corn, and their intestines are adapting to eating corn instead of grass, and therefore their stomachs are less acidic, and that's causing changes in E. coli, which is making this outbreak of 0157. Flu virus, the avian influenza virus, H5N1. This influenza is hugely, it has 8 strands of RNA, and those 8 strands mix a lot. And we'll talk more about that when we talk about influenza, but that's why there's always going to be new strands of flu. Okay. Okay. other things, modern transportation, expanding human settlement, all of these are contributing factors for emerging infectious diseases, as is like humans traveling into wildlife. Like that's what brought on COVID-19 really. Humans kind of killing, moving into the wilderness and killing animals and eating them, and that includes bats and stuff like that. So okay. Okay, bioterrorism is a big deal, okay? Um, you can develop strains of drugs or strains of diseases that can kill people very quickly. Like, if we introduce smallpox into the population, I'm sure it'll kill a lot of people. That being said, we understand that COVID-19 is not a bioterror weapon. It's literally it will be the stupidest bioterror weapon in history if it actually was. First of all, it doesn't kill very quickly or efficiently, and it doesn't kill a lot of people. The mortality rate is relatively low. You want to build a bio weapon, you probably want, you know, you probably don't want 80% of people to be asymptomatic to the disease. Um, anyway, okay. All right. Okay, so epidemiology, okay. Um, the study of where and when diseases happen and how they're transmitted. Okay, really important field. Epidemiologists identify the etiology of the disease, what causes the disease, the other important factors that concern the spread of the disease, and then based on those two, develop methods on controlling the disease. Okay. All right. Jon Snow, slightly different name than the Game of Thrones character. Okay, so he mapped the occurrence of cholera in London. Actually, he did something really kind of cool. Okay, so in 1848, 1849, there was no running water. If you wanted water, you had to get it out of a well. Okay, so he started mapping the occurrence of cholera, and he realized that it was localized to certain wells in London, and so he thought, oh well, that people are getting cholera from drinking from those wells, and he knew he was right, except there was one freaking case that threw off the whole data set. There was one woman with cholera that lived very far away from any available well that had cholera in it, and he couldn't figure out like what the hell was going on. So he went and interviewed the family, and his son, the woman's son, like, oh, my mother, she's really weird. Okay, she loves water from this old well that we used to drink out of. And every day I have to lug water for miles to just bring it to her because that's the water she likes. And bam, totally fits, right? Where she lived had nothing to do with the water she drank. She drank water from one of the infected wells all the time, and that's why she got cholera. And so that was the exception that made the rule fit. Okay, so he was the first person to really kind of realize cholera spread in wells. Okay, okay. Agnes Semmelweis, I'm pretty sure I'm slaughtered the first name, but he showed that hand washing decreased the incidence of puerperal sepsis, childbirth fever. Okay, what he realized, he was in charge of two separate hospitals. Okay, one hospital where they had doctors deliver babies, and one hospital they had midwives deliver babies. I'll let you guess which one. So there was one hospital where a lot of babies died, and one hospital which very few babies died. Take a guess which one. Okay. If you guess one of the doctors, you're right. So he was like, I don't know what the hell's going on. The doctors are obviously better trained than the midwives, so why the hell are they the ones showing like huge amount of people dying of childbed fever? Okay, which is like fever that hits you after you deliver a child, and sometimes a lot of times ends up killing you because after you deliver a child, those days there was no medical care. You were very sick usually, and you lost a lot of blood, so chances of dying increased dramatically. Okay, so he studied most hospitals, and he realized the people who were doctors, the first thing they had to do every morning was do autopsies on the people who died last night before going to help, childbirth and in between those two things, you would think they wash their hands, right? Nope, never wash their hands. Okay, as opposed to the people who were working as midwives, all they did was deliver babies all day long, so that's all they did. Okay, so he realized that hand washing was incredibly important, and no one believed him. And he ranted and raved about it until they threw him in an insane asylum, and he died in an insane asylum. Okay, enjoy. So pretty sad. All right, Florence Nightingale. I'm sure you guys know him, or sorry, her. It's like past midnight here. All right. So Lyme disease cases you can see is steadily increasing. Okay. Lyme disease is by month, and you can see this tells you information, right? The most important information that this tells you is that the summer months are when you're more likely to get Lyme disease. The reason is you're more likely to be outside, and grass grows better in the winter months, especially in Connecticut, where Lyme, Connecticut is, and that's when grass grows. And where grass grows really tall, there are ticks. There are deer and there are deer ticks. Deer ticks transmit Lyme disease, and therefore that's why it's more likely to get Lyme disease in the summer months, as opposed to January and February, where it's freezing to death in Connecticut, and no one goes outside in their right minds. Okay. Okay. TB cases going down. So you don't have to know the difference between these guys. Okay. The MMWR, Morbidity Mortality Weekly Report, is data from the CDC. I used to read that once upon a time. It was pretty interesting. Morbidity is the incidence of a specific disease. Mortality is death from that disease. So morbidity is just illness. Mortality is death. So morbidity will always be higher than the mortality. Okay. Okay. So there you go. All right. Okay. So let's figure out this. Okay. So, which disease is more likely to be fatal? The cirrhosis is much more likely to be fatal if you get it, right? But there's a higher incidence rate of the West Nile encephalitis. Okay. All right. Skip the rest of the chapter. All right. Hopefully you understood all that. I'll be happy to go over this with you guys in class. Okay.